Today we saw what was supposed to be the big picture on regional variations for infections in England. These data are from PHE. In the northeast and Yorkshire, the R number is 0.8. In the southeast, 0.9. But in the southwest, it's at 1. And in the northwest, it's more than 1. Based on the falling number of infections, schools have been asked to open more widely, but today, Tameside Council in Greater Manchester delayed this based on the northwest figure and stretched local health services. Even those modelling these R numbers say that they should be interpreted with caution. They come with huge uncertainty. They're estimates, and they should not be interpreted in isolation. This particular model is one of about half a dozen that's feeding into SAGE.
And I think this obsession with the R number is actually holding us back from understanding where do we look at where the infection is actually transmitting, and where do we look at it in terms of thinking about where we actually manage this outbreak seriously. And I would say to people actually in terms of the R number, to just actually take it with a pinch of salt.
This graph released today by the ONS shows the estimated proportion of the population in England testing positive for coronavirus since the end of April. You can see it's trending down, but the lines on the graph show the margins of error, the uncertainty. These data are national, more localised data are needed.
One of the most important aspects for regional public health right now is to have dashboards of where the outbreaks are. This could be in a care home, but it could be in a workplace. It's understanding that basic data is crucial to the test and trace policy.
There's hope that this new test and trace system will help local authorities stem outbreaks. And while the system is still new, local authorities say they're only getting very basic aggregate data. What they need to know is who has been infected and, most importantly, where they have been infected. Official sensitive test and trace data seen by Newsnight show how limited these data are. One critical element that's missing are postcodes. People do not have to fill these in, but this would enable local authorities to have a much clearer picture about where local outbreaks are occurring.
We're getting some data, but actually what we really need is more quick data so we can actually contain the virus if there is a particular hotspot. It may also assist if we're able to do some local tracing so we can really turn around that data very, very quickly. And that's the sort of clarity we need from central government providing us the information there. Again, that's one of the things that we need to make sure we do have that granular data so we can actually get down to sort of community and street level and really work to clamp down on the virus.
Those local teams might be working with better data than before, but experts say it must get better still if local outbreaks are to be avoided.